Hi, my name is John. I'm one of the students. I was wanting to ask you if you could give me the SBAR report on this patient.
Hey, John. Yeah, let me give that to you. Patient's name is Kind Ryder. He's in room 620. He's a white male with his weight is 171, height 5'11", age is 67 years old. His oxygen stat is 96%. He is a full code. Respiratory rate is 16, pulse 76, BP is 128/70, and temperature is 98.4. Patient is here for a stage 2 diabetic ulcer on his right foot. His secondary diagnosis to that is diabetes mellitus type 1. He's a type 1 diabetic for the last 20 years. Let's see here. So he denies any other illness or injury other than the ulcer. His diet history usually follows the 1800 American Diabetic Association diet. He's got decreased adherence to medication over the last few months, and so he is ANO times 4. His pupils are Perla. Denies any chest pain or complication. Denies any headaches or tingling in the extremities, and denies any urinary concerns and any bowel concerns. So we're here today. We're going to give him some insulin because his glucose level right now is over 290. So you have any questions for me?
Yeah, why specifically is he receiving the insulin? And
Okay. So the patient's receiving the medication because he's got elevated glucose levels and he's a diabetic.
mm-hmm. So what action does this medication have on the body?
The insulin, it'll help regulate his blood sugars and bring him back into normal levels.
Okay. When should you question administering the medication?
If he has a low blood sugar or a normal blood sugar, you wouldn't administer it because you wouldn't want to go ahead and put him hypoglycemia.
Does it have a therapeutic serum level?
No, the only thing that we're going to be checking on this is we'll be checking just the glucose level.
What vital signs should you monitor?
You're going to take a look at all his vital signs, but the specific ones really is just that blood sugar. That's going to be the major one we're going to look at. And then we can also take a look and see his kidney liver function, see how it's affecting, if the medication's affected.
Okay. Which physiological parameters should you monitor when you're administering the medication?
The physiological, you'll take a look at and see what kind of state he's in. You're going to take a look, once again, you'll take a look just really at that blood sugar level and see what scale he's at and what amount you want to administer.
Okay. What interventions should you teach to the client to ensure the medication is administered safely in the hospital?
We're going to go over the five rights, so the right time, right patient, the right dose, medication, and the right route, and make sure that everything's correct.
And what interventions should be taught for taking the medication safely at home?
So it's going to be the same thing. The first thing is going to be the five rights, and then also patient should be aware of the normal and abnormal ranges for glucose. He should be aware of rotating the injection sites, and also how the sliding scale works to make sure he has the appropriate dose.
What are the side effects and potential adverse reactions?
Side effects can or reactions. Side effects is really if he has any type of reaction to the medicine, such as he could go into insulin shock or even hypoglycemia.
And how will you know the medication is effective?
That it's lowering the patient's blood sugar level to a normal range for him, which is it's a little different than your norm for a regular patient that doesn't have diabetes.
Okay. That's all the questions I've got for now.
All right, so we're going to go in and administer medicine for him. So let's go ahead and go on in now. So. Hi, good morning.
Hello.
My name's Chase, and I'm your nurse for today.
Hi, Chase.
Come on in real quick. How you doing? Hi, my name is Chris. Can you do me a favor? Can you tell me your name and your age?
Yeah, my name is Ryder Kind. I'm 67 years old.
Let me just take a look at that real quick. All right, excellent. Thank you very much. So we're coming in today. We're going to give you your insulin. So we wanted to make sure and see if you have any questions. Actually, and I did see that you requested some information. So I've got some information here on your insulins and diabetes. Let me give that to you.
Thank you.
All right. So we're gonna go ahead and get all of your medication ready. Just clean my hands here.
I appreciate
So any
it.
questions or any issues today?
No? No.
Okay. Are you having any pain today on a scale of 0 to 10?
0.
Okay. All right, excellent. So let me just get my medication set up here.
His pain was recently at a 6 out of 10, and he was given.
Now, where do you normally have your insulin injected?
In my belly.
In your belly? Which side, left or right side?
Yeah, I go all around. The
All
last
around?
one was on my left.
Denies a cough,
Okay.
dyspnea, wheeze, or chest tightening.
All right. Where would you like your insulin given today?
We can go on the right side.
On the right side? Okay.
He denies chest pain, palpitations, dyspnea, or
All
edema.
right, give me just one second
Heart
here.
sounds are all good, and with a regular
All right.
rhythm.
I'm just gonna scan your ID band.
He denies any abnormal.
Good.
He denies any problems with the GI system. Abdomen is flat, symmetrical, and soft. Bowel sounds are present in all 4 quadrants.
All
He
right.
denies any problem with the urinary system. Last vital sign was done at 4:45. Heart rate was 76. O2 stat was at 96, and blood pressure was 128/70. Tonight he'll be getting Lantus at.
Try that one more
18
time. It
minutes.
want to take for me.
Last AccuCheck was done.
Excellent.
And his blood sugar was 242.
Got the
He does have
wristband.
an IV in the
Just
right
get your
medial
medicine
vein,
here.
and it's in the peripheral forearm.
So the medicine that we're going to be giving you is your regular insulin. Okay. So
So
let me
because
get
the
that dose ready
type
for you.
2
Okay.
Type 1 diabetic, it's one
Sounds
of
good.
the insulin will keep your blood sugar to a normal level. And it's long acting, so it will act over a period of time. It will act over a long period of time and work to keep his insulin at a maintainable level.
What action does the medication have?
So it promotes storage and inhibits the breakdown of glucose, fat, and amino acids, and it lowers glucose by uptake.
All right. So
of
your blood glucose
in
was
muscle and adipose tissue.
290. So we're going to give 16 units.
Oh, 290. All right.
You want to question if he's showing signs of hypoglycemia, and then you want to, if his last AccuCheck showed that his blood sugar was at a normal level, it could have been dropping, so you want to check it again to make sure that it hasn't dropped to a low level. It's not a fast acting insulin, but if it's at a low level, you want to have it at a normal level to maintain it at that normal level.
Does the medication have a therapeutic serum level?
No.
Which vital signs must be monitored?
So again, vital signs that show hypoglycemia, so tachycardia or fast heart rate.
I'm just going to clean you up here real quick.
A low blood sugar.
So where would you like your insulin given today?
My belly's fine.
In your belly, and you said left side was the last place you administered?
Yep, you
We're
got
gonna
it.
rotate to the right side, okay?
Okay.
I'm just gonna clean here.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
So you want to use the 5 R's, just the 5
Fat,
right
Put
dose,
you away from the umbilicus.
right route, right time, right
All right.
patient, and make sure it's the right
Excellent.
medication.
What interventions must be taught for taking the medication safely?
So let me just document that quickly.
You want to keep the client to make sure the insulin's still good, it's not expired. You keep it in the refrigerator. It can't be kept out for more than 2 weeks. Outside of the refrigerator for more than 2 weeks, and make sure that they're rotating the injection site.
What are the side effects and potential adverse reactions?
Could lead to hypoglycemia if blood sugar was already too low, or if the patient doesn't eat over at the normal times.
What are the
All right, looks like I got everything in here. Any questions or any issues for me before I leave?
Mm.
Do you need anything?
No, I think I'm okay.
Okay, okay. All right, well, you have a great day. So we're going to come back in later in just a little bit, and we'll recheck your blood glucose and see what it's been adjusted to, okay?
Okay.
And you have a great day. If you need anything, the call light's right next to you, so just go and let me know.
All right, thank you.
You're welcome. Head on over.
And can you tell me your last name
Jarvis,
and your date of birth?
it's 67 years
So, I just had a couple more questions for you.
Alright.
So, were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, as we kind of discussed before, so you're going to make sure that it's the right patient, it's going to make sure it's the right dose, it's the right time for that medication, the right route. So you're going to look at your 5 rights, and you know, make sure it's the right medication. So, and you know, right patient, right dose, and right route. Yep. So your 5 rights is what we're going to look at, and also we're going to take a look at his blood sugar and make sure on the correct sliding scale.
Did this affect your decision to administer the medication?
It does. It does. Based on the sliding scale, it tells you how much insulin we're going to give him. And then it'll also just make sure it's at the appropriate time.
And did it affect how you administered the medication?
No, what affected how we